I would like to start by really thanking Joy Lone. Joy, we miss you so much. Joy is a Ugandan, by the way. She was born in Karamoja, and she's been part of our newborn health journey in Uganda. So Joy, we want to thank you very much. And as you said at the end, we look forward to seeing you when you come back to Uganda. So Joy has made a very impressive, she's really very impressive, by the way, very passionate. So I would like to take this opportunity to request if there are 2 general comments. At least we need to give her some comments, because I'm sure she'll be able to answer. I don't know whether Peter is in this room. Peter Waiswa, are you in this room? Or somebody from the team? Okay. So any 2 comments, we could take some comments so she can be able to respond to the 2 comments. Has challenged us that we need to do, I think her last slide, she's challenged us that we need to think about survival of these newborn babies, but also she has challenged us that we need to look at a life cycle approach in this whole approach. She has also challenged us to look at the implementation gaps and also the investment gap. I think that's another thing, but also the innovation. I think it's very important for us to think about that also, because with innovation, actually, you can actually change many and even change the of child. Yes?
I joined the presentation midway. However, I was very, very impressed by some of the lessons, especially from Tanzania, which is close to us, where the government took lead and all other partners came on board. I think that's a very good lesson for us, that we can actually do this if we have, similar countries, take lead in newborn care. Thank you.
The point I think Seed Global is making here is the issue of alignment to one plan. Alignment to one plan. How do we make sure that we are able to align? There are issues concerning governance, being able to make sure that everybody is aligned, but having a clear plan. And this morning we'll be launching our new plan, but also making sure that we can coordinate all the partners and that each partner is very clear about their commitment. I think that's very important. And Joy will say something about that. Comment?
For the presentation, I just need to highlight a few things. For us to go forward, I think what she has suggested is spot on. The most critical thing I also think is getting all these pieces implemented in totality, not in isolation. Sometimes we provide the infrastructure in terms of the buildings when we don't have the equipment, the relevant equipment at the facilities. So you realize that you will not have service provision effected when you have pieces of the tenants of the health system that she has highlighted. I think yesterday some of the challenges we faced was the human resource capacity gaps, both knowledge and skills. So if you have elements of what she has suggested without having all these in totality, we may not get the key outcomes that we are looking at. I think it's very critical for us to implement all these in a package, looking at all the tenets of the health system, incorporating the elements of innovation she has implemented, she has highlighted quality improvement aspects, but we also need to ensure that the coverage of these key elements at all levels is emphasized. It should be just at one level, but across the board, covering all the different levels of the healthcare system up to the community as well. I think their involvement is also going to be very key. I think the last bit I need to mention is the aspect of accountability. She has not touched it well. It is going to be very key from the PSC's speech yesterday. I think it was very evident that we have gaps in holding each other accountable. So how do we enhance accountability at Thank you.
Thank you very much, Kira. The message on convergence, piecemeal approach, integration, but also making sure that all the inputs are there. Yesterday, Dr. Mugahi, in his MPDSR presentation, he showed a glaring gap in the response when the patients are admitted or received in the health facility. There are many gaps in the intervention. There are many omitted interventions. So health workers know what to do, but they're not doing the right thing. And that is a very good hanging fruit we can actually work on. But also making sure that at the end of the day, these very beautiful health facilities we have set up, during the last 6-7 years under AMCHIP, we've been able to construct very beautiful health facilities. We've set up NICUs, we've set up maternity wards, but if we are going to achieve our results, we need to make sure that we functionalize them. And I think that's going to be our next challenge moving forward as we try to dent the mortality, the maternal mortality. We make sure that we functionalize, and we are calling upon everybody outside there to make sure that these beautiful well are actually functionalized. We need skilled health workers, we need people to run these NICUs, we need people who can actually manage these facilities, but also make sure that the equipment is used, because we have so many redundant equipment. We've been discussing the issue of equipment. Some people have equipment, some people don't have equipment, but also how the equipment is managed, how the equipment are processed for infection control. So thank you very much, Dr. Walakira, for that point. There's no other point. Joy Lon, you're still on. You could say some perspectives have been raised.
With the point you made about an aligned plan, and I salute Uganda for your one plan, and that's similar also in Tanzania. They have a one plan, and what they recognized was that, you know, within that there are different places where they need a particular focus for implementation. I think the first speaker talked about the importance of actually implementing. And then I think that the second speaker and also your MC underlined the fact that we need to use what is already there. So I really salute you for having that plan. I do think, as someone who has worked on clinical newborn care across Africa now for 3 decades, that often we didn't fully think about the HR skills for the neonatal part, or we have devices that are a bit hit and miss. So I think in your one plan it will be really critical to make sure that you have a floor plan space, the devices list, but also the HR. So, for example, in Kenya now, they have a pre-service and an in-service neonatal skills training, and then a possibility for a neonatal nurse track. And in district hospitals, neonatal nurses will be more important than the medics. That's true all over the world. The neonatal nurses are actually the ones who have the biggest impact. So I salute you on your deliberations. I really hope that that implementation gap, the systems approach, and some of the innovations, including the kangaroo mother care prior to stability that Uganda is leading on, will be possible to be used and implemented and invested in. So thank you so much. And courage for the race ahead.
Much joy and all the best. Thank you.
Center is Joseph. Is going to take us through the NASMEC activities from where we came from this year. I hope you will be brief and so that we can talk about the NASMEC activities. NASMEC is National Safe Motherhood Experts Committee, which was established around 2020. Yeah, it has a leadership structure. May Secretariat project the presentation for easy follow through. I'll present on the 3 subcommittees. The NASMEC PPH subcommittee is chaired by Dr. Ononge, and those are the activities. The first one that has been able to be done is developing the NASMEC research agenda in areas which are related to obstetric hemorrhage. Then there has been capacity building on new reproductive health commodities, and that is to mean heat-stable carbetocin, tranexamic acid, the non-pneumatic and shock gamete, and the urine baron tamponade. We all know how these are very key as far as management of PPH is concerned. Then there was a training of 50 national trainers on new commodities at Ryder Hotel, and that was supported by UNFP and ACOD. Then Also, regional trainings of trainers that captured around 100 trainers in the districts of Hoima, Mbarara, Mbale, Arua, Guru, and still that was supported by UNFPA and ACOD. Then there's been support for the regional champions from the local maternity and neonatal system platforms to advance emergency readiness and preparedness for facilities, emphasizing PPH given how we know PPH in as far as maternal death is concerned. But also development and design of PPH brochures, which have key messages for both mothers and caregivers. Then their dissemination, and you can see the number of copies, and that was with support from UNICEF. Then, of course, there's been reaching out to the partners to support the translation in order for the messages to reach the end user. Then standardization of the training materials for PPH, and these have been shared across different platforms, and which occurred in September, which is also very recent, and I think all of us still remember. The next slide. Yeah, the last subcommittee is NASMEC PET, which is chaired by Professor Annette Nachimudi and coordinated by Dr. Carol Jacqueline. Their goals are embedded in a simple acronym, which is RIP, reduction of maternal and perinatal mortality due to preeclampsia and eclampsia. Next slide. So their activities, quite a number. They concluded the nationwide dissemination of PET framework, guidelines, and also the essential maternal newborn care guidelines. They established a neonatal team on PET and NASMEC champions across the country, and this support in different areas in as far as PET is concerned. Yeah, they meet quite regularly to make sure that there is ongoing review of the activities. Then also they review the maternal deaths which are PET related across the country, as reported in the different meetings. For that, Medium can summarize the activities of the neonatal subcommittee within.
So much Minister of Health, and for also encouraging these committees basically to run on a weekly basis. We developed the research agenda. It requires funding, and I believe other committees will also generate the research agenda. But when it comes to the implementation, that's where you need basically resources. So IPC and development partners, the Minister of Health, we need to fundraise for some money for this research agenda so that we can have it implemented.